I'm going to place everyone on mute. What's that noise there?
Something, somebody, background noise.
Oh. It sounds like we're getting feedback from somewhere.
Yeah, we're getting some verbal feedback.
The feedback is bad.
Yeah.
You're muted, Alec.
Okay.
There, now you're off mute.
Yep, now we're off. I think we're okay.
Okay. All set? Okay. Well,
All
good
set.
afternoon, everybody. Great to have everybody here today for our, I believe this is our 41st meeting, Wardens Treasurers Clergy. So great to be here. Let's get started with a word of prayer. Let us pray. Gracious and loving God, we give you praise and thanksgiving for the gift of this day and your presence with us. And as we gather today for our Wardens Treasurer and Clergy meeting, we uphold in prayer. I'm just for a second getting that feedback again. Or verbal feedback.
Where that's coming from. Bishop, on mute for a second. Now it's gone away. Okay, come back off mute, Bishop, and see what happens.
Everybody else is on mute, I take it?
Everybody's on mute.
Okay, well, we'll start again and we'll see if there's a spanner in the works there somewhere. So we'll see, we'll start again. Okay, let us pray. Gracious and loving God, we give you praise and thanksgiving for the gift of this day and for the opportunity we have to gather here through this forum with the Wardens, Treasurers, and Clergy of our diocese. As we meet here today, we especially uphold the people in British Columbia throughout the entire province and the challenges that they are facing. We pray for the emergency workers, for those who are facing the loss of livelihood, the loss of their property, the challenges that are being faced in developing emergency response. We pray especially that they will be strengthened and encouraged and uplifted. As we gather in our meeting today, may you be present with us by the power of your Spirit, all that we discuss, plans that we make, the direction that we take in accordance with your holy will and purpose for us. Strengthen, encourage, and uplift us all, we pray in Jesus' name. Amen. As I was saying, this is the 41st of our meetings, and good to be here with you today. Just before I turn it over to Alec and we start having some conversation around the changes that are being made to the COVID protocols and other things that we're working on today, I just want to say, especially to those on the call today who are also Synod delegates, I want to thank you very much for your care and attention for our Synod, which is now a couple of weeks in the rearview mirror. It's hard to believe how fast time goes by, but for all the work that you did with that and the plans that we're making regarding Synod. We had a meeting today with the co-chairs of Synod to do a debrief. We spent our morning working through that debrief and ways in which we'll move forward, and we offer prayers for our new Synod Council that will be meeting this coming Tuesday, and for the new members that will be on that, and the work that we carry on forward. One of the things that I committed to during the Synod, for those who weren't present during the Synod itself, was that following the budget vote, and many of you will recall that the budget vote, I think it was somewhere around 2/3 in favor and 1/3 opposed to the budget. And because of that significant vote in opposed to the budget, I wanted to make a commitment to go around the diocese and have an opportunity to meet with anybody who wanted to chat with me about that and about any thoughts they have around it, anything. We're also going to be doing a debrief with the Synod Council when they meet, and kind of moving forward with that. So I'm starting that. My first one is actually this tomorrow. I'm going up to Kemptville, and I'll be up there at 1 o'clock in the afternoon at St. James Church. So I'm going to each one of the hub locations, and anybody who wants to meet with me, I think Wendy sent out a listing of the dates that I'll be traveling around, and I'm happy to do one-on-one, happy to meet with incumbents and synod delegates from parishes if you want to meet that way. Also happy to arrange meetings in another way. This is just how I'm starting to do it. I want to get it all done between now and the end of the year. So while it's still fresh in everybody's mind and thought, that we can have that conversation, and then we'll go from there. So, and I'm looking forward to it. It's one of the things that, we are seeing the COVID numbers going in the wrong direction in the province, which is causing some concern. Numbers today up over 700, so it's the highest it's been in a couple of months. But one of the challenges is we're still doing well in Prince Edward Hastings and Leeds Grenville, from what I understand. Kingston, Frontenac, Lennox, and Addington is in a place that we've never been in all through the pandemic. So we're getting higher numbers, daily case counts going up. So there's some concern around that. So we keep an eye to what the public health, we consult regularly with the public health units in all three areas, and especially when we're considering changes to our protocols, and Alec will speak more to that. But in spite of that, I am looking forward. I'm enjoying getting out in the parishes. I'm in Christchurch, Belleville on Sunday, my old parish, and I'm looking forward to being with Jeff O'Hare and the great people of Christchurch, Belleville. But it's been wonderful to get back out in the diocese and to get into the parishes to make my visits again, and looking forward. Hopefully that will be able to continue. I'm booked all the way through now, I think almost to the end of the year with parish visits, and looking forward to being present when I have an opportunity to come to your parish. And I love making these visits. It is the absolute pinnacle high point of my ministry as a bishop, are those Sunday visits to the parishes. And they're just wonderful experiences to get out with the people, to worship and praise of the living God, and our discipleship as followers of Jesus Christ, inspired by the Spirit. And it's always that kind of experience for me when we're out in the parishes visiting. So just with that, just to let you know about those visits I'm making around the diocese. I'll be on for the Q&A at the end, but I want to turn it over to Alec so he can get to the meat of some of the questions that I know you will have, and be able to talk to the protocols and some of the things we're dealing with regarding that. So Alec, I'll turn it over to you.
Thank you, Bishop. So again, as the bishops mentioned, we end up in one of these situations where there are a range of different circumstances across the diocese and across the province. The province has reduced the number of restrictions and introduced new regulations. That has created more flexibility for our churches, and that's a good thing. But the risks remain. And as we know, vaccination is one of the key cornerstones for both personal and societal health, but it's not an absolute. It's not something that we can totally rely on as the only way we go. And we're going to speak to that as we work our way through. So the guidelines that we did on the 9th, we had a session and we talked about the draft. We got a lot of input from that day, received some stuff afterwards, continued to work with all three health units. As Bishop mentioned, there's 3 across the diocese. And so dated the 12th of November, we had come up with a new set of our guidelines under the amber stage, because we remain in the amber stage. And they will, for the most part, be effective November 22nd, although congregational singing remains the first Sunday of Advent a week later. And again, just reflecting continued caution, continued allowing churches, expanding actually, that churches can make decisions that meet the local circumstance in your community and the needs of your congregation. We're trying to give the churches more flexibility to do what is right there, but we continue to consult with authorities We're blessed again, as I always mention. We have an epidemiologist priest in the Diocese of Ottawa who we rely on quite heavily. The House of Bishop relies on him both nationally and provincially. And in this diocese, I consult regularly with Michael. We have the health units, and we consult with them as we do things. And we speak with the other dioceses, and of course, watch the other sources of information we have available to us. So one of the things that's key in those guidelines is you really need to shift. A lot of what we've done has been focused around the buildings. You know, we closed our buildings, we restricted capacity in our buildings. We did a lot of things that made it relatively straightforward because the building was the building, and regardless of what went on in it. But the regulations now at the provincial level, and ours reflect that diocesan-wide, now reflect that it's really about the activity level. It's about what you're doing rather than where you're doing it. So worship and services have a set of guidelines around them and choices. Pastoral care, social activities, a lot of questions always about coffee hour. Formation activities, so Sunday schools, confirmation classes, youth programs, Bible studies, etc. A lot of our churches that are hosting to concerts. Some of those are fundraising. It's that time of year where we see Christmas events, parish bazaars, those types of things. Internal meetings, parish councils being an advisory council being a very good example. And of course, the various rental groups, whether they're social services groups like AA, or whether they're groups that use it for seniors programs, or any of the other multitude of things that our churches are rented for. So it's important to look at what the activity is that's going on. So the key changes in the guidelines, and we did make changes from what we provided in the draft. The basic construct around the open versus restricted options, or the choice of the two, remains. So the open options is a choice that's made by the incumbent and the wardens, that proof of vaccination is not required for attendance at worship service. And that means that basically you continue in the existing stage that was the step 3 we were in previously. That keeps capacity limited at what your social distancing limit is, as it was. It requires social distancing, and it places restrictions on social activities. Because what happens with those social activities is it now is either governed by the provincial social activities one, or it restricts because you can't provide food at an open event because you're required by law to treat like it's a restaurant. So the open option is there. You continue with that, and that is an option. And of course, there are churches, there are dioceses that believe strongly that they don't wish to restrict access to the sacrament or restrict access to worship. So there's a number of things at play there. The restricted option, if you require proof of vaccination or proof of a medical exemption for all those over 12, then that can remove the capacity restriction, and basically you return back to your pre-COVID fire restriction. Everybody has a fire restriction based upon the safe limit by the fire department. It lifts the requirement, but of course we still recommend you maintain distancing. It's part of a layered defense, but it does not mean that you have to be physically restricted on capacity. It also, where everyone has proof of vaccination, means that restaurant rules for social distancing can apply, but the social event is limited at 25. So now you can serve food, but again, people must be seated, and people must have, when they are seated, they can remove their masks to eat and drink, but when moving around, they must have their masks on. Congregational singing, however, puts the restriction back on capacity. So that's a factor we'll talk about more in a few minutes, but just so we're clear as we start to step through this, if you choose the restricted option, you can choose congregational singing. But congregational singing now replaces the requirement for social distancing. So your capacity will now be limited under the restricted option if you decide to have congregational singing. And we'll talk about that in a little more detail. So for clarity, singing remains a high-risk activity. The health units are all very clear. The first thing they will say to you, singing remains a high-risk activity. So we need to recognize that. So therefore, it must happen for congregational singing under the restricted option. All singers must be vaccinated, fully vaccinated, and proven on the way in. They must be masked, and they must be distant at all times. And that really doesn't matter whether you're in the choir or whether you're in the congregation. Where there's an ensemble singing, you need to maintain 4 meters from the congregation. So therefore, in most cases, the choir sits in most of our churches either in the chancel or in a balcony. And so the number of singers in the choir is limited by the space that's in that choir stalls, whether it's in the choir in chancel or in the balcony. There is no singing in procession. You have to remain in one space. Choir rehearsals are limited 90 minutes. I can tell you as a former organist and choir master, once you get past 90 minutes or so, you start to drain on people's attention anyway. And contact tracing and self-assessment is still required for choir practice. Congregational singing, as of the first Sunday of Advent, November 28th, can be brought back. But again, what that requires is 2 meters of distance between household clusters. So it basically says that for example, if the bishop is there, the bishop by himself would be 1 socially distanced. If Sophie was there as the bishop, and obviously lives in the same house, the bishop and Sophie can be together. There's got to be 2 meters to the next people. So it's going to replace, and I say now restrict your capacity again if you allow singing. There is an encouragement not to bellow, because again, the strenuous exhalation that brings. So just in general, it's a good idea. People that'll sing, but not actually get too bellersome, even though, as the bishop refers to them, pot boilers do get you wanting to let it go. And again, I will repeat, it does place restrictions on your capacity. If you have instrumentalists, obviously wind instrumentalists, they're limited to 1 unless they're behind a barrier, an impermeable barrier. Some of the other pieces that happened, and we had further discussion with the health units. We spoke to the epidemiologist, listening to the input from the session we did on the drafts. So the slight changes there. So it remains 1 person can remove their mask at any one time. And that person must be a worship leader, obviously. That could be someone reading a lesson. It could be someone doing the prayers of the people. It could be someone preaching or someone leading liturgy. But they must be only 1 person at a time. They must be physically distanced from anyone else by a minimum of 4 meters. It's still recommended that you work in an impermeable barrier, glass or plexiglass. That's still recommended, but it is not an absolute requirement. But that 4 meters is an absolute requirement. Presiders at the altar must remain masked if the elements are within 4 meters of them, and of course during the distribution of the bread at communion. And at this time that we are still not offering the chalice other than to the celebrant. Formation activities are changed. The capacities were adjusted there for those that are 12 and older, youth groups. And then the fundraising guidelines were shifted based on requiring proof of vaccination. But you still are restricted capacity-wise by being able to be socially distant, as stores are in the retail environment. I'm not going to read through the list, but some of the common touch activities, like collection plates, are still not permitted. Continuing to sanitize high-touch surfaces and things like that, so light switches, doorknobs, etc. Continuing to retain contact information. And we're going to talk a bit more about ventilation in a few minutes. And of course, as we talk, books, prayers and books and Bibles may be returned to pews. We talked about barriers. An impermeable barrier is typically plexiglass or glass, and gets that distance out so that basically it stops the droplets and a chunk of the aerosols. A number of churches expressed concerns about the cost. We don't want cost to be the barrier for being safe. So what the diocese is doing is offering up to $150 reimbursement for the cost of one plexiglass barrier. And basically you do that as per the guidelines by sending that to the pandemic email account, a copy of the receipt and a request for reimbursement. We've already had one church do so. We will reimburse up to $150 for a barrier. And as per the guidelines, facial shields are not appropriate as a safety measures for others. Facial shields are very effective, particularly at protecting the wearer's eyes, but are of limited value beyond that. So that facial shields are not an option in that space. The vaccination policy remains. We encourage all to be vaccinated for the care of themselves and for those that surround them. Those that are unable to or choose not to should seriously consider attending either online or participating from there. And the policy requirement, anyone who's leading worship, wardens and others that are in leadership roles and direct contact roles, that is a requirement. And of course, we continue to monitor, continue to look at the provincial, national situation, continue to be ready if required to take a step back. Not something obviously we want to do, but, and as the bishop mentioned, the numbers continue to rise. That is concerning. We continue to be aware that that is a risk, and that in doing so, we need to be conscious that that if the situation and circumstances require it, that we could be forced, or it could be the best for safety for everyone to move back. So we continue to monitor that. The province has indicated that they see that the restrictions will shift again in March. There are those that believe that's optimistic, but the province's view is their target is to start lifting some of the other requirements in March, like proof of vaccination and potentially masks. So one other area we wanted to sort of jump into in a little more detail is around ventilation and how protection happens. So I think, first of all, it's important to think about that we really have approached this as layers of protection. And there's a set of things that are about prevention. And so vaccination and proof of vaccination, self-assessment before you enter, isolating when you have symptoms, and testing Those are all things that are done to prevent the risk happening in one of our buildings. Those are all things that are being done to help say the chances of someone being in our building or at one of our services or an event is lower that someone attending has COVID. However, if someone that is present does have the virus and is shedding the virus, then there's a set of things that are done to mitigate. Ventilation, we're going to talk about in the next few minutes. But contact tracing, physical distancing, masks and sanitizing activities, hands and surfaces, those things are all done that if someone is there at that activity in that building, that you reduce the risk that someone's going to spread the virus. So one of the key ones that we're going to focus a little bit on is ventilation. We've talked about this a number of times. We are moving back indoors. I think you'll find when I walk through downtown Kingston, most of the communities will be the same. The patios are either gone or shutting down. Not so much outdoor activities. I suspect very few are doing outdoor worship right now. Once we're back indoors, the risk is much higher. And recently, the National Medical Officer of Health, Dr. Ma, has recognized that the virus is spread by aerosol as well as droplets. And so the difference in droplets and aerosol is size. So droplets are like small bits of spit that float through the air. Aerosol is more that fine mist. Droplets are affected by gravity much faster, and we're gonna see a video that's going to talk to that in a minute. Sorry, I'm getting reports of noise, so I'm just going to mute everyone in the background. There we go. And so ventilation is an absolutely critical factor. And it's one of those mitigation items that we just talked about. Let's be honest, our buildings are almost all quite old. We've got a few newer ones, but most are old. And they create each building is different and challenging circumstances. So and they're all different in the sense that some churches have a radiator system. And so the heat is distributed in the building. On the other hand, other buildings have central ventilation. So they have a furnace, some have air conditioning, and there is both air coming in and out through a central system, an HVAC system. Very different ways of treating those things. In other churches, the only way air moves, the windows have been sealed up, and the only way it comes in and out is with doors open. So the strategy, regardless of the building, is to reduce the amount of virus in the air, whether it's droplets or aerosol. And the tactics for doing that is basically through the introduction of fresh air into the building and through increasing the amount of exhaust or air going out of the building. So that's bringing fresh air in and reducing the amount of air that's potentially infected with virus because of aerosols or droplets. So air movement is one way. The second thing that is an option is a filter, and HEPA filters, we'll talk about that in a second, as an option, and purifying. Using ultraviolet is another way of doing so. These are all pieces that are possible to reduce the amount of virus that is in the air. So rather than droning on, I've got two videos that I'm going to use. One is, yes, it is an NBC, the Today Show, but it's going to talk, and the reporter does some really great graphic stuff that gives you an idea about aerosols and how this actually works. So I'm going to play this one, and I believe if I've got this right, everybody should be able to hear and see the video. Here we go.
We got no sound on the video, Alex.
Uh-oh.
No volume.
Sorry, okay, let me try that again. Hang on a second. Because the computer, all right, somehow it got turned off. Apologies. Let me go back and we will try this again. I'm going to reshare it. It should have. Let me try again.
Americans are getting back to work, dining, and shopping again. But experts
You
warn
hear that?
indoor activities can make it easy for the virus to spread. Researchers at the University
Yes.
of COVID-19 transmission is nearly 19 times more likely to happen indoors than outdoors. Scientists agree if you're going to be inside, the better the airflow, the lower the risk. To determine airflow, experts use this ventilation smoke device. All you do is crack these two parts and then squeeze out a puff of smoke. That simulates what happens when a person exhales. And if the smoke doesn't move around too much like this, it could be a problem. But watch what happens when I have an open window nearby. The smoke dissipates quickly. So I head out to see how the air is flowing inside common public spaces by tracking the flow of this harmless smoke. We're at the grocery store. Let's give it a try. Take off the cap. One puff. All right. Air. Looks like it's breaking up fairly quickly, actually. All right, we're going to try a different spot in the grocery store, more interior with aisles. There goes the smoke. Now, it's not really moving away from me like it did before. With the driver's permission, I try it inside a rideshare. You can see it's not so great, which is why rideshare companies ask people to put their windows down. That really helps with the airflow. Watch this. Gone. Okay, let's give it a try here in the hardware store. The smoke didn't seem to move at all. I can definitely still see wisps of smoke. Let's compare what happened inside, where the smoke didn't really move very quickly, to what happens when we're outside. Oh, it's gone within seconds. And what about returning to work, where many people use elevators? Doesn't look like it circulates very well. What about a department store as we all get ready to shop again? I can still see it, but it's dissipating pretty quickly and moving away from me. America's got to eat. What about restaurants? The smoke quickly drifts to the vents above me. But watch what happens inside an empty movie theater. So it's moving, but the cloud isn't really dissipating very quickly at all. We showed our videos to Professor Reinhold Lohner. He runs the Center for Computational Fluid Dynamics at George Mason University and uses the smoke tube in his studies. He worked with us last summer to show us what happens inside a classroom with poor circulation. What did you think about what we found?
It shows very clearly that there are certain areas that are problematic, that are prone to pathogen transmission.
He said the places where the smoke didn't seem to move much could mean a higher risk for COVID-19 because the viral particles could linger in the air.
The most concerning to me was the hardware store, and there's barely any flow. If you have another person coming in even a minute afterwards, you would still have particles lingering in there that were exhaled by the person that was there before. The other scenario that I found very concerning was the one in the cinema. This was a very horizontal flow that was slowly rising. So anybody that was exhaling or sneezing in the front, all of those particles were being inhaled by all the rows behind.
What would you say to people who want to go out to see a movie right now?
Wear a mask, and if possible, wear 2 masks. The second thing is only go to the cinema once you're vaccinated.
He said the department store and restaurant HVAC systems worked perfectly, sucking the smoke up and away into the intake vents. But he also warned,
Perhaps if he had measured another location, it would not have been as good. In a pandemic situation, it's always bad to be in a crowded environment.
for now, masks and being out.
So that kind of gives you a good, we talked about cigarette smoke in the last meeting, and this kind of brings that home and really looks at how aerosols are distributed and the effect of HVAC in different environments and air circulation drive the safety of that. I have
Americans.
This is actually a Canadian production that is, again, got some good content in it. It's not quite as long, but I will just play that as well. And hopefully it also has closed
Indoor
captions.
ventilation during COVID-19. Meet Michelle. Michelle is a business owner who wants to protect her workers from COVID-19. Michelle knows that COVID-19 spreads through respiratory droplets and aerosols when infected people breathe, talk, sing, shout, cough, or sneeze. The risk is higher when people are in enclosed and crowded indoor spaces with poor ventilation. Ventilation can help improve indoor air quality by reducing the concentration of any potentially infectious COVID-19 droplets or aerosols in the air. This is accomplished by introducing clean outdoor air and removing stale indoor air. Ventilation can be achieved naturally by opening doors or windows to the outside, or by installing a mechanical ventilation system. The use of a portable air cleaner with high-efficiency particulate air, HEPA filters, could be considered in spaces where ventilation is poor. Portable fans circulate the air, but they do not remove contaminants from the air or improve ventilation. If using a fan, make sure it's not blowing directly from person to person. Michelle's workplace has a heating, ventilation and air conditioning HVAC system, which also filters the air. Michelle makes sure that the filters are cleaned or changed regularly according to the manufacturer's recommendations. She knows it is important to select filters that fit properly, are compatible with the ventilation system, and that have the highest MERV rating possible. In general, the higher the MERV rating, the better it is at removing small particles from the air. MERV stands for Minimum Efficiency Reporting Value. Finally, Michelle makes sure to have regular maintenance performed on the HVAC system, according to the manufacturer's instructions. Michelle also meets with an HVAC specialist to see what she can do to improve ventilation in her workplace. Michelle made sure to ask the HVAC specialist, is the HVAC system operating correctly? Is the HVAC system suitable for the type of setting and the number of workers? Can the ventilation system be adjusted to bring more outdoor fresh air into the building? Is it possible to upgrade the air filters? Ventilation should always be used with other precautions such as limiting occupancy, physical distancing, wearing masks, and frequent hand washing. It is important to use multiple practices at once, in a layered approach. Michelle will incorporate good ventilation practices along with other precautions, as part of her overall safety plan to prevent the spread of COVID-19.
Whoops. So, those videos kind of give us a little bit of insight into the areas that you need to think about around ventilation. One of the things that is you can do as a check. I mean, obviously the smoke test is a potential for testing your, and they use a nice tube, but there's multiple ways to create a little bit of smoke. But that does let you, because obviously our churches probably more resemble the cinema than they did the grocery store or a restaurant where it was drawn up and away. And again, the scary part about that cinema was that it floated kind of at head level on back in the building. And so that's one of the things that we think about. One of the questions I'll look for input when we get to Q&A. For a number of our churches that do not have an HVAC system in the sense of air ventilation, then those are basically closed environments. And that's where potentially the HEPA filter, as you saw it, when I was a kid, it was an air cleaner, that has a level of effectiveness. And again, you need the right amount of fan to circulate the air. Generally, the guideline is 4 to 6 times per hour that you should be circulating all the air in the room. The difficulty, of course, is for most of us, I mean, how many cubic feet of air is there in this room? Therefore, how many is there in your church? How many times does it circulate? How many people? There's a whole lot of things that make it quite complex. But there is an option of putting in filtration in your building, as well as churches that do have a central system with ventilation. And I know at least one church that has put a UV system in to purify the air. So one of the questions that we'd like input on is, are churches prepared to look at those types of solutions? And if so, then, the diocese, can we consider how we might be able to support churches in doing that? But clearly that's an investment in safety that would have to be made at the church level, and a decision that be made. One of the things that's recommended here, and again, I know as it gets colder, it's harder to do, but there's a couple of things you can do. One is cracking doors and open and windows. And again, that crack may be only the width of a 2x4. Doesn't need to be necessarily wide open. If you're going to use fans, you have to use fans to push air out of the building. But cracking windows and doors will give you, as you saw in those videos, more air flowing out, and that's a key factor. Most of our buildings aren't that airtight, so air coming in isn't such a big issue, but you can, of course, open another door or window slightly, but that's at the minimum. The other practice is, where possible, is to ventilate the building well before the service. So again, letting it air out and then letting it warm back up before people come in is another option that you can pursue. But again, recognizing that the virus hangs in the air, the more that you can do to improve air circulation, the better. Final thing to look at is and there is lots of things out there on this as well. If you look at the general topic of air quality, often measured by CO2 or carbon monoxide in the air. And so measuring that is a good measure for how good your air circulation is. So the higher the CO2 levels in your building probably means that the ventilation is less. So one thing that is done is one way of measuring, again, what your airflow is like is monitoring your CO2 levels. And there's information we can post if anybody wants to pursue that. So a few other items that we've been asked about. 2022 financial planning guidelines. So as the bishop mentioned, we have Synod Council next Tuesday night. At that meeting, we expect council will approve the stipend grids, the housing, mileage allowances, supply clergy, interim clergy, all of those types of rates. Once those are issued next week, then next week I will, my intention is to issue you with the 2022 planning guidelines, which will also include, I hope, some guidance on 2022 insurance. One of the challenges that one of the things that I took on to try and do is we We have pursued options on insurance. We saw a major increase last year, as we know. And so we went out. We are part of the national program, but working with some other dioceses, I also pursued another broker. There are very few options out there other than ecclesiastical, to be blunt. Ecclesiastical is one of the few that will insure broadly for both building, property, liability, that will insure faith organizations. So we went out, looked at some other brokers. And by the way, the Diocese of Huron used to use Aviva, and Aviva notified them a year or so ago that they were getting out of it, and they're now with ecclesiastical. I did pursue this with another broker, and basically our loss profile for the last couple of years really means that we would not gain anything and potentially cost us money if we exited the existing program we are in through the national church. So sadly, there had been some hope that another broker would be able to generate us some savings. But based upon the loss profile, which is part of how insurance companies measure you, they don't believe at this time, and we'll revisit in a year's time, but at this time there appears to be, it would be to our disadvantage to consider changing from the national program through Aon into ecclesiastical in Northbridge. So I don't anticipate a change there. I have asked Aon for guidance in terms of the range of increase we should expect. As I mentioned, we've seen, unfortunately, we have seen in the last couple of years, we've seen a number, or in the last year, our incidences of vandalism have gone up dramatically. We've seen the loss of a church to arson, and we've seen continued issues with roofs, the sort of things we normally, and flooding, the things we normally see. So at this point, we don't really have the flexibility to make a change there. CEWS, the government has extended the Canadian Emergency Wage Subsidy out to May of 2022. They have changed, again, the guidelines around it. So we will be, for the month of November, asking you to report the numbers, and we will see if we can get our data in. Still a couple of churches we're waiting for the October numbers, so we can get that in. If you don't have it in by today, we're going to submit tomorrow. And of course, the other area we talked about was at Synod. We launched the new program around REACH and stretch grants. And so I'm going to ask Archdeacon Wayne Varley if he can just give us just a quick reminder and update around the REACH grant program. Wayne, over to you.
Thank you, Alec. Friends, it's good being with you this afternoon for the Wardens, Treasurers and Clergy call. Those of you who attended Synod or participated were made aware of a series of REACH and stretch grants. REACH grants of up to $5,000 will be considered in support of a new and innovative ministry your parish or diocesan group is contemplating. There's certain criteria, and it's intended to serve particular areas of ministry, not all. There will be 3 intake blocks of time next year. However, we want to draw to your attention, we are launching a special intake in December of this year. In other words, if your parish or diocesan group wishes to be considered for a REACH grant of up to $5,000, please submit an application to us in December, and they will be considered. We would really like to be providing some financial support to new and innovative ministries drawn from the Ministry Allocation Fund. There's more information about this on our diocesan website, and I invite you to turn to that at your convenience. Click on Resources, followed then by Grants and Funding, and you will see the Anglican Diocese of Ontario Foundation, the Anglican Foundation of Canada, as well as the reach and stretch grants for our diocese. There's a special email address for this, and the contact person is Robin Jones of St. Paul's Church in Westport. So for more information, or if you wish to make application in December, please contact Robin by email at grants@ontario.anglican.ca. Thank you, friends. Thanks, Alec.
Thanks, Wayne. And of course, that is an exciting piece that we launched at Synod, and look forward to reach and eventually the stretch grants becoming part of our diocesan life. So our next meeting, we do plan on a December meeting. The third Thursday of the month will be the 16th, the normal time and the normal connection. And we will continue. Our plan is to continue those into the new year. So we will, at this point, move to Q&A. The bishop, Wayne, and I are online. I know Trish Miller is online as well. Trish, I've had a discussion with, because of course, apart from being a priest of this diocese, Trish is also an engineer by her previous trade and has done research into areas like ventilation as well. So Trish is available if we've got questions there as well on ventilation. I thank Trish for her support and assistance. As always, you can ask questions by coming off mute and asking the question and going back on mute. Or in the chat line, Molly is available to ask questions that may come up in the chat line. So we can open for Q&A.
Alex,
Well,
George Bale.
Yes, George. Yes, George.
St. John. I'd like to get some pricing in these HEPA filters, and you say you have someone there that's expertise on ventilation. I'm not just sure. You've been in our church. I'm not just sure how many of them we would need for the size of that church.
And again, so what we would recommend is that you talk to someone local, an HVAC vendor, whoever handles your furnace, for example, because should be able to come in and give you advice, and that would be the recommended approach. We will post some information on filters. I mean, places like St. John's are pretty darn good sized buildings, and that's going to be, using room size ones would probably be a little less appropriate. But putting a HEPA filter on the furnace itself or a purifier, for example, I know that St. Lawrence has put a filter in. Has put purifiers in, and we do have information from that. But yeah, the normal approach would be get your HVAC, whoever handles your furnace, to come in and give you opinion, and because they know your system, they're in your building, and then what we'll look at is if there's ways that we can support that, we will contemplate putting some support in place behind it.
Okay, Alex, thank you very much.
We also.
Alex?
Hi.
Alex, I have two questions from St. Thomas's, one on the COVID. You have in the guidelines that it should be glass or plexiglass. Can any other clear plastic, acrylic, or any other clear plastic be considered?
As long as it's impermeable, you are correct. It is the guidelines, because the common ones, but no, an acrylic is also impermeable. So as long as it is an a screen, for example, from a car door or from a screen door would not be an impermeable barrier. But yep, an acrylic, anything like that, that's going to actually stop that flow.
And I have a question from our treasurer to pass on. He was wondering what the status of the green sheets is. Are they being changed? Can he start his prep on last year's versions, or where's that at?
So a good number so two separate buckets. So for the 2020 financial data, which forms the 2022 CMM. Boy, I'm stumbling. So those sheets, many of them were done. I think, as all are aware, Candace has left the diocesan staff. We are just catching up on the ones we still have some in to finish. So for the 2020 data for 2022 green sheets, if you've submitted your data and haven't had it back yet, that'll be coming shortly. We are working on those. What we're talking about for 2021 data, and obviously 21 it's not finished yet, but what we're talking about, the green sheets that will be completed next year for 2023 CMM, we want to do a simplified form. And so that will be a project we undertake. And the intention is that we'll hold a consultation session to talk about, okay, folks, what do you find works with them? What do you find doesn't? Here's what we're thinking about doing. So what we want to do is in the spring do all that, and then mid-year release the new green sheet. And I hope that's an online simplified form. But that'll be 2021 financial data for 2023 CMM. The 2022 CMM, which is 2020 data, if you have submitted your data and not got your green sheet back, you'll be getting it in the next few weeks.
Thank you.
Alex, it's Dale Redding from here in Sterling.
Hi, Dale.
I'm in the, if I remember correctly, for the choices to choose what we're supposed to choose, we're supposed to submit what we're going to choose. Is there a form we're supposed to submit that on, or? Yeah,
we actually have dropped that, given that, okay, given the feedback and given that, that we decided after listening some more not what we need everyone to be sure of is that they understand. If you don't, please ask. And because basically under the provincial regulations, if someone complains, and it's amazing, by the way, that we get complaints about, did you know that so-and-so in such and such a church didn't have their mask on correctly? Did you know that they didn't check for proof of ID in such and such a church? And they didn't check for both vaccination and proof of ID in such and such a church. So if there is a complaint, what I can assure you is, given the level of vigilance in the health units, that they are investigating complaints. And so what you don't want to do is have the health unit arrive and go through what you're doing. So please make sure that you work it through. If you have a question, please ask us and we'll help you with it. But there's no need to advise us which option you're choosing. And again, if you want to, and I just hear there's two things I've always heard in the last few months. I think the Bishop and Wayne the same. What do we want? What do we want? Well, apart from not having to wear masks, we want singing and we want coffee hour. Those are the two things that was the most common refrain. And so if you're choosing singing, you're automatically into the restricted choice.
Yes, yeah, I get that. And the other part of this is for Christmas Eve. The question was asked me, and I think I have the answer. We don't pass the plate for offering, but at Christmas Eve we always lit candles and we had a candle from one person and then we passed the flame on. Is that allowed?
So again, if you can manage socially, if you're singing, you need trying to maintain the social distancing, but that should be at a reasonable distance. If you're not singing at the time, that should be doable.
And Alex, can I interject and say, think about how people are going to put their candle out. They can't exactly blow them out. So perhaps hand out candles as you're leaving the door and sing Silent Night outside, and then people can, more safely extinguish their candle. We don't want everybody lifting their masks and blowing out their candles. That kind of defeats the purpose.
Very good point, Trish. Thank you. I hadn't thought all the way to the end. I had my head around.
I thought about that too. And that's what I thought. They'd take it out and we put it in whatever. I thought about that too, but thank you.
Having done it with choirs processing at Advent, with choir of 40 processing and trying to keep boys' candles lit, that was the problem was more getting them lit than it was than blowing them out. But yep, I think that's a good point.
Alex, Wayne here, St. James and Maitland. One of the things that we have decided to do for Christmas Eve, during our Christmas Eve service, we've traditionally had candles that were given out when people came into the church, and then they were lit just before we turned the lights down and sang Silent Night. Okay, so what we're doing this year is my wife and I have offered to donate the small battery operated candles. So everyone coming in will pick one up, take it with them, turn it on during Silent Night when the lights are lowered, and then they can take it home with them. So there's
very nice touch, Wayne. Very nicely done. I think that solves a whole lot of issues.
Yeah,
and
you can buy them at the dollar store or wherever. Yep. They're not that expensive, you know. But anyway, one other comment question that I have, just to clarify, for example, I know that we have our vestry council meeting tonight, and the other two churches have already had theirs for the month. And it looks like pretty much the other two have decided to go with the non-restricted, like pretty much the status quo, what we are doing now. And I have a feeling that our church will probably do the same thing because the feeling is nobody wants to restrict somebody from coming to a service. And we've been following the guidelines at all three churches pretty closely. So the only thing is that means, just to clarify, that our speakers, readers, clergy, so on, cannot remove their masks. Is that correct?
Again, that requires vaccination for everyone in order to be able to do so, yes.
So if we choose that option, then nothing changes.
Pretty much.
Yeah. Okay, just to clarify that.
Yep.
Yeah.
And that again, and there are things, and this come up, I think, on the last call. And again, you can change by service. For example, you could at your 8 a.m. or Christmas Eve, you could do, your 4 p.m. service as a restricted service with singing, and the 10 o'clock service as an open service without.
Right.
Similarly, events, we were asked a question about parish, you mentioned Parish Advisory Council. And again, having discussed that with the health unit, not a requirement for an internal church meeting for people to be vaccinated. That is a choice that the wardens and incumbent can make, but that particular event could be open, but the services on Sunday could be restricted. So you can mix and match according to the local needs and requirements.
Yeah, just another observation, not going to name any names or anything, but we became aware of a church in the area, not an Anglican church, another church, that is renting out their gymnasium, their meeting room, which is doubles as a gymnasium. But anyway, they're renting it out without any vaccination requirements being, is that against provincial regulations?
So it depends on what, because again, it's not the building, it's what it's being used for.
Well, it's for a meeting.
Whoever is renting it out is responsible for whoever the group that's renting it becomes responsible for what's happening. So, for example, if it's an exercise group or a nursery, a day care or something like that, the provincial regulations govern them. But it's also gets cloudy because the church itself is then the landlord and is responsible for ensuring that their renters are clear on what the regulations are. So again, for the church, it's iffy. And the health unit and the actual individual inspector or enforcement agent would be the decision on that.
Yeah.
And again, they're all human beings. They all operate differently, interpret the rules differently. Each health unit, the medical officer of health, is given different instructions. I can tell you that for sure because I talked to all 3 health units.
Yeah. Well, I know, for example, that the majority of people attending the meeting, including the leaders of the meeting, are not vaccinated.
And that's a choice that they've made. And again, the safety of those around them, that's a choice that they make.
Yeah, yeah. Not that I'm going to report anybody or anything like that. We don't want to do that, but just, it just seemed odd that others can do it and we can't.
It is, but again, there's inconsistencies throughout the system, and we will always err on caution. And I think, again, there are churches that vary. I had a call from the United Church at the regionally assembly level talking about how we've done this and specs and everything else. So yep, it's different by denomination, that's for sure.
Okay.
Alex, Charles Morris here. Can I just come back to the previous question? Did I understand well the option for worship leaders when speaking to remove their masks? That option is tied to the restricted option?
That's correct.
Okay, that's not clear to me from the guidelines. I thought that was a separate thing unrelated to whether you were doing open or restricted. I'm not saying it doesn't say that, but that wasn't obvious to me. So I'm glad the question was asked because I didn't understand it that way.
Okay, we'll check that to be sure, but that is the clarity that we intended.
So if you're doing open option, everybody masked at all times, including speakers at microphones.
That's correct.
If you're doing restricted option, you have the option then to remove the mask when speaking.
That's correct.
I've got that straight. Thank you.
Yep. And again, the background to that is that you can be vaccinated even though and still transmit. The chances if I've got it and I'm vaccinated and me transmitting it to someone else that's vaccinated are significantly lower. And so given that once you've removed your mask, you have increased the chance for someone to spread. That's why that proviso is there.
Valerie Kelly with Christchurch, Gananoque, and Rockport. Just to be clear, it says if you take your mask off, you have to be 12 feet or 4 meters from anyone else. And it says and or behind a plexiglass. So you can have your mask off and without a plexiglass?
We recommend the barrier, and we're prepared to back that up with $150 of support, but it is an or. So it is the safest option is to have the barrier. It is not a requirement. The 4 meter distancing is not optional. The recommendation is to have both 12 or 4 meters and a barrier.
Thank you.
Molly, do we have anything else? Thanks, Sharon.
We do. We've got a couple of questions in the chat. Margaret Ray says, with only one door into our church and windows shut, is it wise to run ceiling fans as it moves air down onto the people? Our exterior door is the only way to bring fresh air into the space, other than the HVAC system. We are using a higher grade of filters in our furnace.
Right. So, interior fans, or ceiling fans, right? A lot of churches have them. What the value of them is circulating the air and doing so at a low speed, right? And drawing and having them, I can never remember which way is which. So they go up. So right, you can have those ceiling fans running. Obviously, if the HVAC system is on, you want to get as much exhaust. And again, your HVAC company, your furnace company, can tell you if there's ways to increase the amount of air that's exhausted outside and drawn in. But cracking that door open, even just a few inches, that's why I mentioned a 2x4, is going to dramatically increase the amount of air that can get out or get in. So I would, again, you would look to keep your system running as fast on high speed, and to keep it exhausting as much as possible, and finally to circulate your fans on low speed, so that that the air circulates. Margaret, did that answer? I see your hand up as well.
Yes.
Did that answer your question?
The fans only draw air down. They don't pull the air up. It comes down. So
most of them have a revert. Okay, and most
no, they're old.
Reverse.
They're in the ceiling. They're
Okay.
old ceiling fans. No choice.
If you've got an HVAC system, I would say then I'd leave the fans off.
Okay. Thank you.
John Schreiner, you asked a question earlier. Is that have you got another one?
You answered it, Alex. Thank you.
Okay, good. Wayne Thornhill, did you get yours answered? I'm just going through the hands that are up.
Yes, I did. Thank you.
Okay, thank you. I don't see any other hands up. Molly, any other questions in the chat?
Just one from John Schreiner, but it's being answered, so that's it.
Excellent. And anything else for the question? Great, then we will continue to respond as we need to. If things change, you'll hear from us. If you have questions, pandemic@ontario.anglican.ca, and we check that regularly. And we will then turn back to the bishop.
Alex, do you mind if I just take a moment to plug the Tidely workshop on the 30th?
Sure.
Good afternoon, everyone. I just wanted to take a quick moment. I put this in the e-news last night under the diocesan events, and we're hosting a workshop through Tidely. Tidely is the company that hosts our website, but they are also primarily actively engaged in online giving platforms for parishes. That's kind of what they started out as before they branched off into other services. So I've asked them to host a series of workshops, and I wanted them to begin with a workshop that especially talked about the tools that they offer for their online giving platforms. There's a couple of churches in our diocese that have signed on with them and are currently using them, and I think I've had pretty good results with them. But so on Tuesday, November 30th at 2 p.m. there'll be a webinar. The link is on the website under the events section that talks about it, and I can send it out as well as a standalone link. But especially treasurers out there, clergy who want to find out more about Tidely, setting up with Tidely for online giving for your parishes, they don't charge anything if you're signing up for their giving platform. It's when you add other things on that then there is a cost. But if you're just getting on board with them for their online giving, it's a no charge fee, and they offer many different tools for online giving. They also offer a wide variety of summary reporting, tax receipting, monthly, quarterly, yearly reporting. So it's quite a robust system that they offer. So that's Tuesday 30th at 2 p.m. and look forward to seeing people. you'll join us for that. Thanks, Alex.
And ladies and gentlemen, I have a major announcement to make before I turn back to the bishop. I have an annual quota, given being human, I have an annual quota of 2 mistakes a year. And I now must report that I have consumed my second one. I'm not prepared to talk about the first one, but I have now run out because the bishop has pointed out to me that in answer to the previous question, I erred and strayed like a lost sheep. And actually, I erred back to the previous draft we had done, that the appendix makes it clear that the unmasked worship leader is an option in either the open or restricted. So I think Charles, Valerie, I was incorrect in my my clarification, and I now unclarify myself. I will. I now confess to my my error, and it is in either option. The mask can be removed by one worship leader, either 4 meters and or with a barrier. So I apologize for that. It was in the previous version, and to be honest with you, we've done so many as we did updates and versions, I got even myself confused. Mea culpa.
Just to clarify that, Alex, does that mean that more than one person, for example, readers, whoever is at the lectern individually can remove their mask to do their reading and then sit down and the next person does the same thing?
That's correct. That means that you go to the lectern with your mask on. You can, once in place and distanced and or barriered, you can then remove your mask. When you're finished the reading, you would then put the mask back on and in reverse, and then go back to your seat, the next reader. We do, again, best practice, you would still recommend if you're sharing a microphone that it's not a bad practice to wipe, to have a or wipe there to wipe the microphone down just in case. If there's any contact, because some people do adjust the microphone. If you're not touching the mic, there's no need, but if you're going up to and adjusting the mic, you could have transmission that way. Again, low probability, but best practice.
But also, Alec, if you're taking your mask off to speak, I think it definitely should be wiped off, because even if you don't touch it, you could have that mist if you're speaking. I would think it definitely should be wiped off.
Best practice is to wipe it down. Yep.
Thanks, Alex.
You're forgiven,
Bishop. I will turn to the bishop later for absolution of my sin, but for now, let's turn back to the bishop to close this with prayer.
I think, Alec, I just see one hand up. I think Philip. I think that's Philip Burry with his hand up.
It was, and I'm sorry to interrupt, but just to follow up what you said, Alec, the requirement for a barrier or for distance remains.
That's correct.
Yep.
Got it. Thank you. Just wanted to understand.
Again, preferred both, but minimum of one.
Got it.
Very good. Thank you very much, everyone. And I have to, Alex, not totally your fault, because 10 minutes before the meeting, I was walking around here in my usual state of ennui and confusion, asking questions of things I should know the answers to. So I had you off base there for a bit before the meeting started. So I think I planted a bad seed.
But I was emphatic in my response, wasn't I?
You were very emphatic in that. And so we go. Anyway, thank you very much for all your work, Alec, and for all of you on the call today for your attention and diligence. It was a little bit longer call today, but it's good for us to go through this information in small detail. And it's very, 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 very important that you ask the questions that you've asked. And if you're not sure, one of the things from the previous call, some conversations I had following where some people felt reticent to ask questions. And I want to encourage people, if there's any sense in which you're not 100% certain, my rule is I'd rather be asked a question 5 times and never be asked it once and something get missed. So I want to just encourage you and thank you for your questions and your engagement today on the call. So with that, let us all close together in good Anglican fashion with the grace. For the grace of our Lord Jesus Christ
Jesus
and the love of God,
Love of
the
God,
fellowship of the
fellowship
Holy
of the Holy
Spirit, be with
Spirit.
us all evermore.
With us all.
Amen.
Amen.
all, forevermore.
Blessings, everybody. Have a wonderful afternoon.
Amen.
Good to see you all.
Blessings. Bye, everybody.
Bye.
Bye.
Thanks, Alex. Thanks for all you do.
Yeah.